Hello, my name is Roud, and I'm a board-certified endodontist practicing in Wellington, Florida. Endodontists are specialists charged with diagnosing and treating diseases of the pulp. People commonly refer to us as root canal specialists. We are the specialists charged with saving the teeth that otherwise might need to be extracted. In my everyday practice, I find that sometimes there is not enough time to talk to my wonderful patients about some philosophical aspects of dentistry. That's why I would like to make this video to answer some of the questions that I commonly hear in this chair. One of them is, how come my tooth had never been painful until the dentist did some work to it? What the patient is trying to say is that the tooth was asymptomatic, which means no symptoms, pain, or discomfort until some of the dentistry was done. To answer that question, we need to look into dental anatomy. Anatomy is a science that explains how the teeth are structured.
Keep in mind that this explanation is a simplified one, and in reality things are a little bit more complex. The portion of the tooth that we see when we smile in the mirror, dentists call a crown. Not the artificial crown that sometimes the dentist makes for the tooth, but the white portion of the tooth that the tooth comes through the gum with. We don't see the roots because they sit in the jawbone covered by the gum. There is a small opening on the tip of each root, or two, or more, and the inside of the tooth communicates with the outside. And the tissue inside of the tooth, dentists call the pulp. Commonly, people refer to it as the nerve. It is a little bit more complex than the nerve, and the main ingredients are the nerves, blood vessels, and other tissues. It is a very fragile tissue. If it is irritated, touched, or insulted, it may deteriorate, it may die, and the bacteria may come in. Common insults to the inside of the tooth, the pulp, come from three major sources: deep decay, deep filling that usually leaks, or a fracture. None of those three have to touch the pulp, because under a very hard shell on the outside that we call enamel, the tooth is quite porous and bacteria can travel a small distance. When they reach the pulp gets inflamed, pressurizes, and it should be associated with the pain. However, the same avenue that the bacteria takes to come in, the pressure may take to release itself, and there will be no symptoms and no discomfort or pain. Then the dentist comes along with his instruments and his materials in an effort to seal and restore the tooth to its original healthy self. In some cases, that may seal the inflammation and pressure inside of the tooth, inside of the pulp, and it does not release itself anymore, but has nowhere to go but deeper down inside into the pulp tissue, into the roots. They get more inflamed, they may deteriorate, they may die, and the infection may settle in.
And now, you may need a root canal.